All right. So what is the definition of survivorship? We'll first take a look at this with the National Cancer Institute defining survivor as that an individual is considered a cancer survivor from the time of diagnosis through the balance and challenges of his or her life. Family members, friends, and caregivers are also impacted by the survivorship experience and are therefore included in this definition. So all the patients, family members, caregivers who are here with us today and online, you guys are all in the survivorship process right now. And the primary goal of long-term survivorship is to empower patients to take ownership of their care and long-term health. This is through education, assessing needs, and ensuring that proper tools for success are in place. And why is survivorship important? Survivorship includes not just the physical, but the mental as well. It's shown that up to 75% of survivors have health deficits related to their treatments. And over 50% of cancer survivors have chronic pain and fatigue. 70% have experienced depression since diagnosis, and a third have dealt with infertility. And now we can take a look at survival rates, specifically in melanoma. In December of 2022, the Journal of the American Medical Association looked at long-term trends in melanoma mortality rates in the US between 1975 and 2019. As we can see, the mortality rates have declined significantly since 1975, with the biggest difference being between 2013 and 2017, with the approval and the implementation of immunotherapy. And on the topic of immune therapy, we'll take a look at survivorship in the setting of side effects from this systemic therapy, and for patients who have and are currently receiving immune therapy. As many of our patients know and have experienced, immune-related adverse events, or IRAEs, are prevalent and can extend far beyond the completion of treatment. And while most of these are temporary, some can be long-term, and like Dr. Kennedy had touched on, this is not a one-size-fits-all type of treatment. In 2021, the National Cancer Institute conducted a study in which researchers reviewed medical records of 387 people with advanced melanoma who were treated at 8 hospitals between the United States and Australia. And it was discovered that more than 40% of patients developed a long-term immune-related side effect. Most of these side effects did not go away during the nearly 1.5 years that patients were tracked. And overall, 167 patients, or 43%, had an immune-related side effect that lasted for at least 3 months after completing treatment with an immune checkpoint inhibitor. This is what the researchers labeled as a chronic or a long-term side effect. The vast majority, or greater than 90% of long-term side effects were categorized as mild, though they interfered with activities of daily living, quality of life, and they required treatment. So even though they were categorized as mild, they still significantly changed the way patients lived their lives prior to starting treatment. And the most common of these immune-related adverse events were adrenal insufficiency, arthritis or joint aches and pains, conjunctivitis or blurred vision, or thyroiditis or hypothyroidism with the inflammation of the thyroid. Many of which our patients here today are currently managing. And when we look at what we as healthcare providers can do, referrals to respective specialties play a large role in survivorship. We're lucky to have so many specialists who are interested in the development and management of long-term IRAEs. Patient education prior, during, and after treatment remains essential, and understanding that the impact of chronic side effects on quality of life can really be highlighted when we specifically ask about them during our patient visits. And I will just talk a little bit about the pharmacovigilance clinic at Taussig. I know Dr. Kennedy touched on this. But this was created in September of 2023. It's half a day each week on Friday afternoons. And it was created because with the increasing approval of new immune checkpoint inhibitors, the need for referrals for IRAE diagnosis and management is also increasing. Many of these IRAEs involve multiple systems, so a multidisciplinary clinic approach allows timely access for evaluation by the appropriate subspecialists. And in long-term survivorship, it can provide longitudinal care for chronic IRAEs. And I included the same picture with Dr. Kennedy and the other physicians at the PV clinic. And some of the specialists that she highlighted, we had like rheumatology, pulmonology, endocrinology. We were having gastroenterology, cardiology, dermatology, so lots more, and basically all of the ologies. And additionally, preventative care should be emphasized in long-term survivorship, and this still remains really important after a stage 4 diagnosis. Primary care is the first line of defense in healthcare. It's encouraged for patients to continue to see their primary care provider during and after treatment. PCPs perform wellness exams, they provide anticipatory guidance, they help with medication management and conduct screenings for chronic diseases such as diabetes and coronary artery disease through your A1C and your cholesterol. And all of these are really important for long-term health and quality of life as well. And additional cancer screenings are recommended to the general public are also recommended and encouraged for patients with a stage 4 diagnosis. It's just as important to treat the existing cancer as it is to prevent any other cancers. So we can see all the different guidelines that we have for things like skin cancer, breast cancer, cervical, prostate, colon, oral, and lung cancer for those at higher risk. And then another important aspect of survivorship is assessing what life is like after cancer diagnosis and ensuring that those proper tools for success are in place. Education promotes patient empowerment and confidence, and research has shown that people who feel more in control not only feel better, but they function better in their day-to-day lives. Developing a new normal and new expectations is a challenge after such a life-changing diagnosis. In focusing on what is modifiable, such as like diet, exercise, this can provide that sense of control. The National Comprehensive Cancer Network also publishes melanoma-specific patient education each year, which is a great resource for patients and the care team and can be found on their website. And there are also more interactive ways of providing education for our patients. Something that we did have and that we're working on bringing back to our department are shared medical appointments, or SMAs. Some of you may have been involved in one of these in the past, but this is a 90-minute appointment with a provider and a facilitator. It's with 10 to 12 patients with a similar condition or a chronic disease who are seen in sequence. And it combines the traditional one-on-one provider visit with participation in a shared discussion. And when we look at the benefits from a provider and a patient perspective, there are a lot. For the provider, there's improved access to patients. We can leverage more resources. It improves workflow efficiency, and it removes redundancy. For patients, there's access to additional learning resources. They have increased time with their care team, and there's opportunity to meet other patients undergoing similar treatments and experiences similar to what we're doing today. And advocacy and support are beneficial in long-term survivorship, and they provide a sense of community for patients. There are a growing number of organizations for cancer survivors, and these are just some of the organizations that are focused on melanoma, such as AIM at Melanoma. They're each specific to a unique mission, and these organizations can be found on the NCCN website, and is also a great resource for our patients and our care team as well. The Taussig Cancer Institute also has survivorship-specific resources, which I think we're going to hear a little bit more about soon, but I'll touch on some of them. with the Fourth Angel Mentoring Program. This is where caregivers are matched with trained volunteers based on similar age and cancer experiences. And this provides empowerment for patients. They provide knowledge, awareness, and hope. Art and music therapy, meditation, and Reiki, those all focus on engagement and self-expression, both of which have shown to improve mental health overall. In understanding that a cancer diagnosis not only impacts the patient, but those around them, we have care partner services available as well. And again, just highlighting some great melanoma advocacy and support groups that are available to our patients. And all in all, the key takeaways, there's a growing number of survivors each year, and we expect to see that trend continue through the development of new treatments and best practices, such as the ones we just heard from Dr. Trong and Dr. Isaacs. Education encourages patient empowerment, and it provides the tools for success. Close collaboration with other team members, specialties, patients, and caregivers optimizes quality of care. And most important of all, long-term survivorship is holistic and places an emphasis on the fact that treatment extends far beyond the disease. These are my references, and thank you all for allowing me to talk today.